I'm Dr. Bill Williams with the Catholic Medical Association, and I'm here to talk about the mandate. Now, according to the HHS mandate, preventative care services must include free access to contraception, morning after pills, and sterilization. Some have stated that the HHS mandate is a victory for women's health, that free access to these services empowers women. But let's take a quick look at the risks and benefits of these services. The risks of surgical sterilization and tubal implants include infections, pain, blood loss, and bowel or bladder perforation. Sterilization is often not reversible, and many women later deeply regret the loss of their fertility. In addition, these procedures render a normal functioning body system non-functional. In terms of health benefits, there are none, because no disease has been treated and no pathology alleviated. The risks of morning after pills include nausea, vomiting, diarrhea, abdominal pain, fatigue, headache, menstrual changes, and dizziness. Morning after pills taken after a woman is ovulated prevent an embryo from implanting in its mother's womb, thereby inducing an abortion. In terms of health benefits, again, there are none, because no disease has been treated and no pathology alleviated. The risks of hormonal contraceptives include nausea, weight gain, sore or swollen breasts, spotting between periods, and mood changes. And then there's more serious side effects like blood clots, heart attacks, strokes, increased risk of breast cancer, increased susceptibility to papillomavirus infection, and therefore increased risk of cervical cancer. Now, there is a decrease in the risk of ovarian cancer, but considering that the International Agency for Research on Carcinogens has declared estrogen and progesterone class 1 carcinogens, overall, the cancer risk is very likely higher. Hormonal contraceptives have a high incidence of breakthrough ovulation, wherein the egg is released, can become fertilized, and then the hormonal contraceptive works like a morning after pill by preventing implantation and causing a chemical abortion. Again, no disease has been treated and no pathology alleviated. It's also worth noting that these treatments have other side effects. For example, married couples that use contraceptives have a divorce rate of around 50%, whereas those that use natural methods of family planning have a divorce rate of less than 5%. Contraception, morning after pills, and sterilization all have serious side effects, and yet they treat no disease. They're bad medicine, bad for women, and no one should be forced to pay for them. Yeah. You know, there's been talk of a war on women going on in this country, and I believe there is a war, but it's a propaganda war. It's a war to convince women that their fertility, which is a great good, is bad and should be treated like a disease with pills and with sterilization and surgical procedures. Women deserve better than that. We need to stand up for women, stand up for their dignity, their integrity. We need to bring the light of truth into this debate and defeat this mandate.